All right. Hi, guys. It's me again. I'm Psychira. I'm a family nurse practitioner, and welcome to NP Now's YouTube page. So, on this channel, I'm going to be going over all things NP, especially new graduate nurse practitioners, because that's the population that I chose to focus on and that I feel needs the most support. Because I, for one, was a new graduate nurse practitioner at some point in time, and I needed this support, and I'm here to try to be that support for you, especially if you don't have like a real true mentor around you. So just a little bit about myself. I've been a nurse practitioner for about 5 years. I've been a nurse for over a decade. I have a background in ER, urgent care, primary care, occupational health. I currently do aesthetics, and I work in surgery now. So I have a lot of experience in different backgrounds. I actually am just coming from my urgent care job today, but I have also just come off of a do nothing December. My eye was twitching me for about 6 months, probably because of stress or because I needed to just relax. And I'm happy to report my eye has stopped twitching. My eyelid has stopped twitching. And if you know, usually your eye twitches because of stress or because of lack of sleep or because of dehydration. And I probably had some or all of those issues. In the month that I took off to finally get back, be refreshed, so I can come on here and I can start doing the work for you guys so that we can get you guys being more confident in nurse practitioners so we can get out there and do our thing. So if you don't know already, I have a website. It's called npnowllc.com. On there is where I'll be posting my videos. I'm going to also be selling things like courses. I also offer mentorship, speaking engagements, hopefully soon because of the coronavirus. That will, I'll be able to open up my roster, but my mentorship roster is open. So you can reach me at my email address on my website, my phone number, all that information is on there if you're someone in need. So after my Do Nothing December, I decided that I'm going to come on here every Sunday, post a new video about something NP, whether it be for new graduates, something that's new in the news or something like that, something to just basically get us tips, things like that for you guys to just help you out with the transition from RN to NP. So today I was at work. I was actually doing a COVID drive today, and I decided to just, because I was thinking like, what can I talk about today? Because I really wanted to do something to start off the year new, and some, like, I know a lot of people are transitioning from different things off the holidays, starting jobs and things like that. So I looked up, Googled problems that are affecting nurse practitioners. The top 3-4 things that came up were primary care gap, legislation changes, scope of practice, like the restrictions that we have, like, you know, us having to have a collaborator, and then also a few other things came up as well, but those were the top 3. And then I more specifically looked up to see what the top issues for new graduate NPs were. So some things that came up were like finding a job, hitting your first job, the cost that you endure with like getting licensed and certified, stress, the knowledge gap or like the learning curve, because now you're going from being a nurse practitioner, you're going from an RN working on the floor, taking orders from physicians and in mid-levels, or advanced practice providers, to actually putting those orders in and, you know, understanding the rationale behind why you're putting those in. And then also the feeling of transitioning from that role of, being the one that to carry out those orders to being the one to actually initiate putting in those orders in. So I go over a few of those things in my new grad NP course, which is on my website, npnowllc.com. It's called a new grad navigator course. I go over like a whole slew of things. It's like a 2-hour, 45 slide thing that I go over. And it's actually on sale now for $199. So you can head over there and purchase that if you'd like. But on here today, I decided, since it's the beginning of the year And I feel like a lot of people will possibly be looking to do different things like get a new job, maybe. I thought maybe I would go over something about jobs. So what more than would be a good topic as far as, finding questions to ask during an interview. So I thought about the previous interviews that I've been on. I will say I probably have been on about maybe 25 to 30 interviews since I've become a nurse practitioner. And some of them I've taken the jobs, and some of them I've gone on them for practice. I know that sounds kind of bad, but guess what? It made me a better interviewer for sure. So I'm happy that I did that. Sometimes I went on the interview to just see where the market was with, like, what do they say to new graduates, like, or to new nurse practitioners as far as money is involved. Like, I just wanted to find out, that for the most part. All right. So my big questions when you go on an interview, always, let them tell you how or what to expect and whatnot. Let them do their speech, but you should at least ask, if not like one or two or maybe three questions, three big questions. And my big three questions are: one, what does the orientation entail? Am I going to get 1 week of orientation? Am I going to get 3 weeks of orientation? Am I going to be oriented by another nurse practitioner? How savvy are they? Am I going to be oriented by a resident, a physician? Like, how well or how long have they been doing this thing? Especially if you're in a specialty, you want to know how long these people have been doing this, because you don't want to be jumping into something. I mean, of course, you're going to do your own research, but you don't want to be taking everything to heart, everything that they say. But you want to make sure that you have a good, well-rounded orientation. As well as, also would like to know, my favorite question to ask on an interview is, give me a day in the life. Like, I want to know from start to finish. So I'm going to come in, I'm going to clock in, I'm going to go see 50 patients and go home. Is that my day? Or am I going to be, come in, I have a schedule on my desk, I have someone telling me, I have an assistant here who's going to be doing, X, Y, Z. Do I have a scribe? Do I have, am I going to get a break? What time is my break at specifically? What time am I going to be able to, go home? Do I have admin time to be able to chart and do things and catch up, especially if you're working in primary care, because you have a lot of follow-up phone calls, a lot of medications to renew and refill, a lot of charts to check. Patients sometimes need to be called. Sometimes they need prior authorization, things done. You really want to know what a day in a life. And I always ask this question because this question lets me know, it at least gives me an idea of what my everyday is going to be about. Of course, it's not going to be perfect because your day is going to be your day, but it at least gives you an idea of how the interviewer perceives you to be in your position, as well as how they expect for you to they expect for you to function in your position. And if that doesn't mirror or line up with what you have in mind or what you want, you have the option of, going separate ways. And then my third big question, which is actually a newer question that I thought about, is how did you guys do during COVID? Did you close? Did you furlough your staff? Like, what happened exactly? Because we all know now that COVID was like such a blessing in disguise. Now we know that, we have to kind of do things a little differently, do things remotely. Telemedicine has been booming because of COVID, but that gives you an idea of how strong this company is. Do you want to go with a company that is really innovative and is very agile, can be flexible with different demands when it comes to the economy and the world? Or do you want to go with someone who's very fragile and can close at any second? Like, you don't want to base your full-time main income on a job like that. So those are like the biggies. Some other questions I would ask is what kind of challenges the company is facing, what kind of patient acuity are you going to be seeing, especially if you're working in like emergency room? Are you going to be in fast track? Are you going to be in the main ER? Are you expected to do both? And then also, what about like the previous provider? Now, this is a biggie. I need to back up, actually. This is a real biggie for me because I would like to know why the previous provider left that position. Were they unhappy when they left, or did they just have a life change that it just didn't fit for their lives anymore? That is a real biggie. Like the fact that if someone left because they were being abused, like in the workplace or something like that, is a big red flag. I will want to know about that. They might not tell you that, but you can also get an idea or a feel of how they answer that question about, you know, if this is a good fit for you as well. And if you can meet that provider, that would be even big. And also you would want to ask, like, maybe, do they have any concerns about your ability to actually fulfill this role? Because a lot of times some people will say, oh, we're willing to train, but then they give you 2 days and then you don't meet their expectations. And then it's like, you don't fit the role, so we're going to be done with you. So you want to make sure that you ask about, you know, any concerns about you not being able to fulfill the role and what kind of support you're going to get in the event that you need that support and where it's going to come from. And I would then also just cater it to the specialty. Say, you know, what are the most common diagnoses I'm going to be seeing here at this facility or at this role? Give me an idea of like the top 10 or something like that. And I do go over that. And I also provide a list of top 10 diagnoses in my course, because I feel like those top 10 diagnoses, you get them down pat no matter what your specialty, psych, peds, women's health, urgent care, ERs. I mean, it's there for you. I think if you get those 10 diagnoses down, that the ones that you're always going to be seeing, when you get the ones that you're not used to seeing that are not as common, you have that time to really look them up and get to familiar with them. And then that actually takes off a lot of the stress from, you know, of time restraint. So I'm happy to be back. Thank you for watching my channel. You can follow me on Instagram. My Instagram is NPNow LLC. And I'm also on Facebook at that same name. And of course, my website is mpnowllc.com. So, you know, you can go on, log on, you can find me there. You can also send me a message through my form online. I actually have my mentoring panel is open for the year, or open for this quarter rather. So if you need a mentor, if you're a new graduate nurse practitioner, you're just starting out, you need some type of support, someone to run through diagnoses, interview questions, salary negotiation, anything you need, I've been there. Call, send me a message. You can call me as well. I'm here to support any way I can, because if I can help you, then you can help another, and we can just begin to elevate our nurse practitioner profession one NP at a time. All right, thanks. Bye, guys.